My name is Dr. Shahid. I'm a pediatrician and medical educator. So this is a lecture series on preventing burnout, resilience for doctors and medical students. So in these videos, we're going to be covering various topics related to developing resilience and preventing burnout. In this particular video, we're going to be talking about positive thinking, reframing, and optimism. So let's go ahead and get started. So this is the overview of wellness and resilience that I like to use. I like to view wellness and burnout on opposite ends of the spectrum. So if we can do things that promote wellness, that will help reduce burnout. And I further divide it up into developing resilience and preventing burnout, but the blue arrows between the two indicate that it goes back and forth, that anything that develops resilience will help prevent burnout, and anything that prevents burnout will help develop resilience and therefore promote wellness and therefore reduce the risk of burning out. And then I've listed different wellness strategies and wellness dimensions, resilience strategies, self-care, and organizational strategies. And again, the blue arrows indicate that there's overlap and you can go back and forth between each one of these. So anything under the resilience category helps develop resilience, but also prevents burnout. And then things related to self-care will prevent burnout, but also help develop resilience. So this is not an all-inclusive list, but again, I think this is a start and a lot of things that can be helpful and that have been shown in the literature to be effective in developing resilience and preventing burnout. So in this series, or in this lecture particularly, we're going to be starting to talk about these areas and these strategies of resilience. And if we look at these 7 components a little more closely, they actually spell out the word program. And this is kind of a resilience program that you can use to help develop resilience and help prevent burnout. I think this is a program that could be useful for practicing physicians, for residents and house staff, and for medical students as well. So program and this resilience program is all about positive thinking, reframing, optimism, gratitude, reflection, altruism, and meaning and purpose. So we're going to talk about all of these in the next couple of lecture series as part of the resilience program. And in this particular lecture, we're going to focus on these 3, positive thinking, reframing, and optimism. Then in upcoming lectures, we're going to be talking about gratitude, reflection, and altruism. And then in a separate lecture and video, we're going to be talking about meaning and purpose. And then there'll be other videos that will talk about other aspects of resilience beyond this resilience program as well then. So let's go ahead and start to talk more about this. So I like this quote. It kind of defines resilience and talks about what is resilience. So resilience is accepting your new reality, even if it's less good than the one you had before. You can fight it. You can do nothing but scream about what you've lost, or you can accept that and try to put together something that is good. So I think this is a great approach to resilience, that it's all about accepting what's happening and accepting the new reality. And sometimes that new reality might, in your mind, might not be as good as the one before, because you have to change and you have to adapt. And maybe it was a negative circumstance or a stressful situation or an adverse event that you're going through. So maybe that new reality isn't less good, but it doesn't help to fight it and scream about it. But what you need to do is accept it. And then also try to see something good in it. Try to identify something positive, something good, something that you can benefit from, something that you can learn from that circumstance. That is what resilience is all about. We're going to talk about different aspects of that. So positive thinking and reframing. This is an important strategy for resilience. And it develops a nice cycle, right? When you have positive thinking, that allows you to reframe things that might be negative, but you reframe them into something positive. And that ability to reframe negative circumstances into something positive and finding the good in it allows you to stay optimistic. And then when you have optimism, that allows you to maintain positive thinking, and it creates a nice positive cycle where the positive thinking allows you to have good reframing skills to see the positive, and that makes you optimistic, and then that gives you more positive thinking. So I think this is very important to maintain resilience. So we all have different experiences in our life. Some are positive, some are negative, and all these experiences really affect our thinking and affect our approach to our life. Unfortunately, sometimes we have negative experiences, and these negative experiences can then really cause a pessimistic outlook and pessimistic thinking. It can drive negative emotions. It could shape negative actions, and it could influence negative outcomes. So we have to be aware of the effect that negative experiences have on us. And we all have a negativity bias. We all know this, right? We all have negative experiences, and that we remember them much more vividly in our memories than any positive experience. So we all have this negative bias, and we know that negativity begets negativity, and that can become and lead to thinking that is irrational and persistent and even destructive. We also know that it takes at least 5 positive actions to overcome 1 negative action. So again, we have to try to see things in a positive way and reframe things in a positive way. Because when we keep thinking of things as negative and we see things as negative, and we fall victim to our negativity bias, then it's hard to break out of that. And like it says, we have to many times have 5 positive actions to overcome that 1 negative action. Okay, so reframing. What is the process of reframing? So basically, that means that you have to learn to correctly identify your negative thinking. Then you have to answer that negative thinking back, and you got to refute that negative thinking, right? And then you reframe the negative by focusing on the positive, right? So first, you got to identify that, okay, I'm having negative thoughts right now. I got to stop that. I can't be thinking negative thoughts. But let me think of something positive, and then you reframe the negative by focusing on something positive and finding something positive in that circumstance. So reframing allows you to correctly identify that negative thinking, answer that negative thinking back, and refute that negative thinking. And reframing the negative by focusing on the positive. Reframing these negative thoughts gives us the power to reverse that cycle away from the negative outcomes and more toward positive outcomes. So we got to break that cycle of negative thinking and refute that negative thinking and start thinking more positive and look for the positive, look for the good in that circumstance, and reframe that negative into something positive. So it doesn't mean that we convince ourselves that a bad experience was good, right? It just means that you consider the situation and look at it from a different perspective or a different angle, and try to look at it from the positive and try to find something positive in that bad experience. So when we reframe the negative, we basically are searching for opportunity in the midst of that adversity to extract some positive meaning from that adversity, from that tragedy. And when we're able to do that, we can actually really learn and grow from that experience. So when we find something positive, we find something meaningful out of a negative experience, it allows us to grow. It allows us to develop different skills. It allows us to gain from that experience and maybe share that experience with others and benefit others from what we have learned from that negative experience that we might have been going through. So again, the process of reframing is you analyze the negative outcomes, specifically looking at your personal thoughts and your feelings and the actions that shape that outcome. You recognize and label those negative thoughts as distorted and that they need to change. And then you seek alternative perspective. You look through an alternative lens and a positive perspective to achieve healthier thoughts. And then you affirm these thoughts until those previous negative thoughts are refuted and the feelings and behaviors and outcomes begin to change. So reframing means that you are flexible, and resilient people are also flexible. They know when to accept that which cannot be changed. They positively reframe life's challenges, and they regulate their emotions. So part of resilience and part of reframing is being flexible and changing your view, changing your perspective, knowing what you can change, knowing what you can't change, and accepting that then. So when you are resilient, you are flexible in the way that you think about challenges, and you're flexible in the way that you react from an emotional perspective to those different stresses. So you accept what cannot be changed, and you learn from failure. You grow from setbacks. You learn and grow from adversity and stressful situations. And you use negative emotions like grief and anger, and you turn them into positives, and you fuel compassion and courage and those emotions instead. And again, you search for meaning and opportunity in that adversity. And that really enhances resilience then. So reframing allows you to accept things. And acceptance really enhances your resilience. So part of resilience and positive thinking and reframing is being flexible and then being accepting of the things that are changing. And this acceptance allows you to tolerate highly stressful situations. Acceptance is not the same as resignation and doesn't involve giving up or quitting. Acceptance is based on realistic appraisal and active decision making. So you kind of reflect on the situation and you appraise and assess the situation and you make an active decision about, okay, can I do something about this? And if I can, let me try doing that. But if I can't do anything about it, let me just be flexible. Let me accept what's happening, and that can help really enhance resilience. Then I like this quote: "Acceptance is the peace that comes with letting life happen without forcing it." Right? So many times, we want things to go a certain way, and we're forcing things to go a certain way, and that adds stress and anxiety, and we expend a lot of energy. Right? This is saying, you know what? Acceptance allows you to have some peace with what's happening in your life. Whatever happens, happens for a reason, and you just kind of go with it. And you don't force it. You just accept it, and that will really help preventing burnout. Then optimism. So optimism ignites resilience. Optimism is a future-oriented attitude and a confidence that things will turn out well, right? So if maybe things aren't going well today, but tomorrow is going to be a bright, new, sunny day, right? So you think ahead to tomorrow, and you think ahead, but you have a positive attitude, and you're confident things are going to turn around, are going to get better. Optimists believe that good things will happen to them, and that with enough hard work, they will succeed. And this is very different from pessimists. Pessimists see the future as dim. They believe that bad things will happen and doubt that they have the skills and stamina to achieve their goals. So optimism doesn't mean that you blindly ignore life's problems, right? You have to have realistic optimism. So you pay close attention to negative information that is relevant to the problem being faced, but then you disengage rapidly from problems that appear to be unsolvable, right? So you look for issues, you look for problems, and you address the ones that can be addressed and can be changed. But if the problem doesn't, have a good solution, or you can't really be changed, you just kind of disengage from it, and you move on from it, and you accept it, and then you are optimistic that things are going to get better as you move forward. Optimism increases the capacity to positively reappraise situations that initially appeared negative, right? And that's important for reframing, because reframing allows hardships to be seen as a challenge to find opportunity embedded in adversity. And realistic optimism, again, you don't deny that difficulty is being faced, but you tend to look for the silver lining, right? So optimism allows you to reframe things in a positive way, to find the positive, and to break that cycle of negativity. And you look for that silver lining. You look for the opportunity to improve and to change and to grow. And you look for something good in the face of something that may be difficult, or some sort of adversity. And optimism really promotes active striving versus pessimism, which creates feelings of weakness and helplessness that may lead to unhelpful behaviors such as self-pity, resentment, denial, and avoidance of problems, right? So we want to be optimistic because that pushes us forward. It motivates to strive and to excel and to meet challenges and to work through them. So what are some ways to become more optimistic? So here are 4 that are outlined. Number 1, focus your attention on the positive around you, right? So look for the positive, focus on the positive. Intentionally think positive thoughts and do not dwell on the negative thoughts. Number 3, reframe the negative and interpret events in a more positive light. And number 4, behave and take action in ways that build positive feelings. So I think these are all very important. I want to highlight number 4 because number 1, 2, and 3 is about yourself and looking at the positive and reframing the negative into the positive. Number 4 is behave and take actions that build these positive feelings. And one very important aspect of resilience and optimism and positive thinking is always be around positive people, right? Be around people who are optimistic. Be around people who give off a positive energy. be around people who look at the bright future, right? That is so important into maintaining resilience and to maintain optimism and positivity. Because if you're around somebody who's negative and who's a pessimist, they're going to bring you down as well, and they're going to suck that life out of you. They're going to suck the energy out of you, and you're going to start feeling burning out, and that's going to really adversely affect your resilience. So make sure that you are around people who are positive, who are optimistic, because they can give you energy, versus people who are negative and pessimistic. They take the energy out of you, and that puts you at risk for burning out then. So again, focus on the positive. So instead of habitually noticing the negative and the threatening things, we need to build a habit of seeing and noticing the positive, and the hopeful stimuli that are around us and in our environment. And we have to make a conscious effort to be aware of those stimuli around us and to focus on the stimuli that are pleasing and positive. Again, we have to break that cycle of the negativity bias that we have. Look for the positive things. Actively look for positive things around you, in your environment, in your household, in your family, in your colleagues, your coworkers, in your work, and everything that you do, and focus on that positive then. So cultivating these positive thoughts, we have to train ourselves to think and insert positive thoughts and avoid dwelling on negative ones. And then when we think about these positive thoughts, we have to savor them and hold those positive thoughts and think about that for a good 10 to 20 seconds, because that will make us feel better, and that will brighten the day and make us feel happy and bring joy to us. So we need to find those positive thoughts and kind of dwell on them a little bit, savor them and hold them for a little bit of time, so we can really relish those positive thoughts, and that can really make a huge difference in your thinking then. And again, cultivate friendship with positive people. I mentioned that already. You have to be around people who are positive if you want to maintain resilience and prevent burnout. And that is important because optimism and or pessimism can be contagious, right? So energy, positive and negative, is contagious, and optimism and pessimism is also contagious. So that is so important in maintaining a positive attitude and being optimistic and maintaining your resilience and your wellness and preventing you from burning out, is to make sure you're around people that can help you in that, because optimism and pessimism can be contagious. So when something happens, we have to interpret that event in a positive way if possible, right? When something bad happens, we have to realize it's not going to last forever, right? It's going to get better, right? We have to keep these adverse events within their limit, right? Don't let them take a life of their own, right? Don't let it take over your other aspects of your own life or take a life of its own, right? To keep it in the space that it's at, you know, and realize it's gonna get better. And then think of other strengths and resources that can help you deal with the problem, right? Rely on other resilience strategies that you have, other social support network that you have, and other strategies, whether it's mindfulness or prayer or spirituality, or it's exercising and working out, or whatever it might be, right? Whatever gives you energy, whatever helps you relieve that stress, and helps you get through different problems, use those resources and use those to help you get through it. And sometimes we might not be able to get through it on our own, and then we have to rely on other resources and outside resources, and maybe even professional resources to help us through these difficult situations. And nothing wrong with that. We should take advantage of all those resources that are available to us. Then again, notice the good in everything and try to reframe it in a positive way. So I think this is a very interesting study. This came out a couple years ago, in which they had healthcare workers look at their day, and then at the end of their day, they asked them to write down 3 good things that happened to them at the end of the day, and reflect on that day. And what they did, they asked them to do that for 15 days straight, right? So write down 3 good things every day for the next 15 days. So that was 45 good things that they ended up writing down in that 15-day period. And what they did was they then evaluated at baseline their emotional exhaustion scores, their depression scores, their happiness scores. And then after this 15-day intervention, they had them reassess their own emotional exhaustion scores and depression scores and happiness scores. And what they found was this exercise of writing down 3 good things every day for 15 days straight significantly improved their overall emotional exhaustion scores, their depression scores, their happiness scores, 1 month after the intervention, 6 months after the intervention, and even 12 months after this intervention. So again, thinking positive, writing down 3 good things every day can really help make a big difference in your overall happiness. It can help prevent burnout and depression and exhaustion. So that's what we need to do. Is at the end of every day, this might be an exercise that you can do. Is start a little journal, start a reflective journal, and write down 3 good things every day, right? An appreciation journal or a good thing journal or whatever you want to call it. But at the end of every day, reflect on your day. And again, it's so easy to think about the negative things. Think about the positives. Write down 3 good things that happen to you at the end of the day, and do that on a regular, ongoing basis. And that's going to make a difference in your wellness, in your resilience, in your happiness, and help prevent depression and burnout and other negative things. That so I think that's one strategy that can really enhance resilience is to make that habit. And maybe you're not good at writing things down. You don't like to write things down in a journal. At the end of the day, think about 3 good things that happen to you, right? As you're going to bed, as you're lying down to go to sleep, and you're winding up for the day, right? So maybe you don't want to write it down, right? But at least in your mind, think about 3 good things that happened to you today, 3 things you were happy about, 3 things that brought you joy, 3 things that you were, appreciative of. Think 3 things that you were grateful for, something like that. Just think about 3 total things that happened to you that had a positive effect on you that day, and do that on a regular basis, and that will really help promote resilience and help prevent burnout. So this study, I think, is really important in that regard. Okay, so in addition to the suggestion of writing down 3 good things every day, or thinking about 3 good things every day, another little exercise that you might want to consider doing and practicing your resilience skills of optimism and reframing and positive thinking that we just talked about. So part of the exercise is, again, thinking about the wellness wheel, right? Thinking about different aspects of wellness, the different dimensions of wellness, and how you can improve your own wellness in each of these aspects of the wellness wheel. And now, maybe as part of an exercise, you can do this right now. You can stop the video momentarily and think about this and reflect on this, or you can do it afterwards as well. But maybe take a minute or two to think about the different wellness dimensions, right? And use the skill of reframing and positive thinking and optimism, and use it to think about something positive related to COVID. Right, we're all going through COVID right now. We've gone through COVID for the last several months, right? And no telling how longer we're going to have to deal with the COVID pandemic, right? And COVID definitely has had a negative effect on so many aspects of our wellness, right? COVID has definitely had a negative effect on our emotional wellness, and our social wellness, and every aspect of all these components of our wellness, right? But now let's use the skills that we've been talking about of reframing, of positive thinking, of optimism. And maybe think about one thing in each one of these wellness dimensions that is a positive effect that COVID had on each dimension, right? So for example, maybe through COVID, because of all the social distancing and the travel restrictions and things like that, so maybe you end up FaceTiming an old friend that you hadn't been in contact with in a long time, right? Because you're not able to travel and visit, and you see them, every now and then when you get an opportunity to travel and see them in person, but you can't do that. So now you FaceTime them, right? You have a Zoom meeting with them, right? And then you see them in a virtual or remote capacity, right? That adds to maybe your social wellness and your emotional wellness. So that's a positive effect that COVID might have had, where you're reaching out to people that you hadn't reached out to in a long time, but now you take this opportunity to be able to do that then, right? And let's say maybe you decide to try to eat more healthy, or because you can't go out to restaurants and there's restrictions on dining in. So you decide to cook for yourself at home, right? You learn how to cook healthy meals, right? So that is making a difference on your physical wellness, right? It's making a difference maybe on your financial wellness, right? You're not going out to eat because of all the restrictions of COVID, but the positive effect of that is that you're learning a new skill, right? That's intellectual wellness of how to cook healthy foods. And by eating healthy foods at home, that's helping your physical wellness. That's also maybe helping your financial wellness, because you're not spending a lot of money by going out and eating out and sitting in the restaurant and spending money that way. So maybe there's that positive effect that COVID is having, right? So instead of taking and looking at a negative perspective of we can't go out to eat because of the restrictions of COVID, flip it and reframe it and find something positive. So the positive of that is that you are now cooking healthy meals at home that is adding to your intellectual wellness because you learn a new skill. It's adding to your physical wellness because you're eating more healthy, and it's adding to your financial wellness because you're saving money by not eating out, right? So, and again, maybe other aspects, other positive effects that COVID had. Maybe now, because of COVID, you're thinking more about faith and religion and spirituality, which you hadn't done for in a long time, but now you have a moment to be able to do that. So that's adding to your spiritual wellness, right? So again, trying to find different positive things from this negative pandemic that is going on around us. Instead of focusing on all the negative things that's happening, reframe it. Try to find something positive and look at each one of these wellness dimensions that are highlighted here and maybe try to find some positive effect that COVID had on each one of those dimensions by using the skills that we just talked about of reframing and positive thinking and optimism. So that's an exercise that you can maybe work through either now or afterwards that can help practice the skills that we've been talking about in this lecture then. So as we wrap up this particular lecture, so again, we've been talking about the resilience program that we're going to be working through. And we talked about in this particular video, positive thinking, reframing, and optimism. At upcoming video, we're going to be talking about gratitude, reflection, and altruism. And then in a video after that, we're going to be talking about meaning and purpose. So in upcoming videos, make sure you try to participate in those and finish up this resilience program. But then beyond that, after we've talked about different aspects of the resilience program, we're going to be talking about other aspects of resilience as well. Other future lectures and videos are going to talk about emotional intelligence and self-awareness and self-management, and then also how to use your social support system and relationships and mentors to help develop resilience and other aspects of resilience as well that we're going to be talking about at future videos and lectures. So again, hope to see you at the next one that again talks. We just talked about positive thinking, reframing, optimism. We're going to be talking about gratitude and appreciation, reflection, and altruism at the upcoming one. Then subsequent one about meaning and purpose. But then several more talking about other aspects of resilience. So hope to see you at those future lectures and videos as well. So hopefully this was beneficial, helpful, and I want to thank you for your time and look forward to seeing you at future activities as well.